So joining me now in the studio is Beth Clay, Executive Director for the Northeast Wisconsin Mental Health Connection. So thank you very much for being here.
It's my pleasure.
Awesome. So can you tell me a little bit about the new Mental Health Connection and how it got started?
You bet. So the new Mental Health Connection was born out of the findings from the LIFE study, a Theta Care mental health plunge, and a mental health summit that took place in 2011.
So lots of stuff.
Yeah, and the community was further motivated by the cluster of suicides in Kaukauna that was mentioned earlier. And that really kind of shook the Fox Valley into a place of needing to know how to respond to mental health in a public health kind of a way. And so we've been working collaboratively since then to move the needle on the large-scale, systemic, and complex issues of mental health. We serve as a backbone organization for all of the agencies that work together on this, and our mission is to lead that collaboration to create and continuously improve an exceptional mental health system of care for Outagamie, Winnebago, and Calumet counties. Mm-hmm. And we are a member organization. We have membership with over 50 members that include the large health organizations, Theta Care, Affinity, and Children's Hospital, as well as community resource agencies like Homeless Connections and Sexual Assault Crisis Center, and school districts, municipalities, law enforcement agencies, faith communities, really
everybody.
Every stakeholder in the community has a place in working on the mental health system of care.
Awesome. So that that's impressive already. We haven't even gotten started. So there's been a lot of attention on children's mental health specifically. I know folks, we've talked about the teen suicides recently, and then the Kids in Crisis series put on through the local newspapers. So can you talk a little bit about the specific initiatives focused on children's mental health?
Absolutely. So again, because we were born the way that we were, we've had a children's mental health initiative since 2011. And the focus of that initiative is to look at education, screening, and access are sort of the focus areas. Mm-hmm. So education of the places where our children are. So pediatricians, clergy, school staff, and parents and families. Mm-hmm. And then screening, we're looking at screening across the lifespan. So we just heard about the teen screen, or the screening at the high school level, but really young children's social emotional health is an indicator for their later mental health. So screening across the lifespan. And then kids have special access challenges, and so that's sort of how school-based mental health was born as well. You know, let's have those children be served in the place where they are, and help families not have to leave work to do those things so that they can prioritize their child's mental health. And so this initiative has really served as a springboard and support for the school-based mental health program for the pilot E3 program that's in Hortonville School District. Okay. That's working all the way from prevention through intervention with their kids. And it sort of incubates new initiatives as well. So within it, we're looking at adverse childhood experiences and how that can underlie and be part of youth mental health.
Gotcha. So, and then in addition to youth work related to mental health, there's also services and work on adult mental health as well. So can you touch on that just a little bit?
Sure. So we have had these initiatives up and running for some time. We have one that looks at strengthening 24/7 crisis response and what our stabilization services are. And that sort of looks also at diverting from jail and getting people to treatment instead. We have a No Wrong Door initiative that really looks at getting to the right services at the right time, at the right intensity, and navigating the system. We have a primary care physician training program because we want to see mental health integrated into our physical health. We have a zero suicide initiative that looks at bringing that philosophy to the Valley, that there is no number of suicides that's acceptable. And we've recently brought under our umbrella the Fox Valley Substance Abuse Coalition that works in 4 pillars, and that's a cross-county collaboration.
Awesome. So all of these partners and all of these counties and municipalities and everything kind of all came together to work on something pretty exciting that we found out in June. So can you talk a little bit about the big news?
You bet, because it is really, really exciting for our community, and I just feel really thrilled to be part of it, because I think it's going to be this is really the time of change making in the Valley. So this project is funded by the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin. It's one of the most brilliant funding models I've ever seen in my life working in nonprofit. And they're funding 10 community coalitions across the state of Wisconsin, and we are one of those coalitions. We all know that mental health is a prioritized challenge and health need in Wisconsin and locally. And the Kids in Crisis series helped us really to see that. And also the adult mental health system of care is equally in need of improvement. So this funding award is really about us doing something about it. So I feel so proud of that. Our coalition is going to be connected with all the other communities that are funded in a learning community and will give us access to national level technical assistance. And it's a long range funding model. So we have 1 year of planning, we have 5 years of implementation, and then we have 2 years of sustainability planning. The first year is really about the learning and planning, so we know many of the challenges we have, some of them we don't, but we really need to dig deeper and find out why, so that when we come up with creative and radical solutions, that we really start to see the needle move.
Awesome. So I'm sure we'll have a lot more to come
Absolutely.
on all of this exciting mental health systems change
Yes.
in several years to come, and hopefully in the near distant future as well. So thank you, Beth, so much for being here today. If anyone wants to get a membership application to be a part of the New Mental Health Connection, that is available up on the New Mental Health website, so make sure you check that out. Otherwise, if you want to connect with Rethink, our website is rethinkwinnebago.org, and a lot of that information is also available on there as well. So please stay connected with us through all of our social media outlets, Facebook, YouTube, Twitter, and until next time, we'll be out there making it easier for people to make healthy choices, and we hope you will be too.